Okay, good afternoon, everybody. I hope you're all well today. My name is Robtel Pailey, and I'm an assistant professor in the department, as well as one of the co-chairs of the departmental seminar series. And I'm really pleased for us to welcome today Dr. Miguel Niño-Zarazúa from SOAS University of London. He is an associate professor of development economics at SOAS. He's a leading international expert in the area of social protection and welfare institutions, which he will speak about today in the Global South, with extensive research in the political economy of taxation and redistribution, poverty, social exclusion, inequality, and polarization, informality and labor market policies in both low as well as middle-income countries, and the intersection between foreign aid and economic social development, which we'll talk about a bit today as well. His most recent book is called The Politics of Social Protection in Eastern and Southern Africa. It was published by Oxford University Press in 2019. And the title of his presentation today is Aid's Impact on Social Protection in the so-called Global South. Without much ado, let's welcome Dr. Miguel.
Thank you so much. I'm very pleased to be here. We are not so far from each other, but it's funny, so we don't interact very often. We are very busy, and it's great to be here, see new faces, and many of my colleagues wanted to come, but obviously they were busy. In the end, they didn't come. Today, I want to talk about a topic that follows some of the work I did when I was at WIDER. I don't know if you know about UNU WIDER, but it's an institute, part of the UNU. You know, the UN is an institution. So they have this network of institutes and centers. So WIDER is based in Helsinki and is primarily focused on development countries. So as part of this large project we did before, we tried to understand the effect of aid. It has been a very controversial topic over the last 3 decades. And then more recently, when I left WIDER and joined SOAS, I've been working with the Swedish government, trying to, in a way, find ways to improve the way they allocate resources. So as part of this work, something came up to discuss the role in enhancing welfare institutions in low and middle income countries. So they wanted, and this is one of the questions we also wanted to understand, is the role of foreign aid or overseas development assistance in the process of scaling up social protection institutions in the Global South. And something which is very interesting, I don't know how much you have been following the dynamics and the evolution of welfare institutions over the last 30 years, is something very unique in terms of these policies that emerged really in the late 1990s. Before, we had a few examples of welfare institutions, primarily in social insurance, that borrow from the Bismarck model, but because of the conditions of the labor market, just cover a fraction of the population. So in Latin America, social insurance cover around 15% of the working age population. So you see there's a significant percentage of the population uncovered, unprotected to idiosyncratic and covariate shocks. So this transition is not random. It didn't come just by chance. So this is the response of multiple factors that I will discuss later. In part, in Latin America, also in sub-Saharan Africa and in Asia, political transitions. There were a lot of political transitions in the late 1980s. I'm Mexican, so I was very young in the late 1980s. I still remember going to the rock concerts, which were forbidden on that time because rock was something bad, right? So we have to go to these illegal concerts and run after the police was coming because, the oppression during these dictatorships and these autocratic regimes were something that many of you have no idea, how many societies have to go through this. So through the process of democratization, imperfect, but still a process of democratization, there were some spaces for demanding a change in the status quo. And part of that was increasing demands to address poverty, among other things. So this increase in the scale of different types of programs, and I will reflect this that kind of dynamic. No? It's just not only the politics, but also many other factors. During the early 1990s, many countries suffered terrible financial crisis. So suddenly they saw the fiscal space quite reduced, and they had to resort to innovative approaches to deal with the effects of those crises. So there are multiple factors explaining this expansion, but also it's interesting that different types of programs have been evolving that also respond to different political incentives that regimes have to implement different policies, and I will talk about this. So, which is interesting is this massive expansion also is linked to the role of foreign aid. So one of the things that we also know is that the distribution within regions and countries also varies substantially by different types of populations. If you look at the distribution of those who are currently receiving a type of kind of protection or coverage by different type of policies that target, for example, children or people, for example, who are unemployed or vulnerable populations, they vary substantially. No, also, unsurprisingly, sub-Saharan Africa is the region with the least covered population. No, but even within sub-Saharan Africa, there is a massive differences in the distribution of coverage. For example, the elderly, about 1/3 of people in old age in the whole region is now protected by old age pensions, whereas mothers and newborns, unemployed, or people, for example, who are vulnerable, they are really unprotected. So there's significant differences in terms of the population that also reflect institutional capacities, financial constraints, and also political incentives. No? And we will talk about this afterwards. So the main question that we try to address in this question is, has foreign aid contributed to the development of social protection that we saw, this expansion? And if so, how and under what conditions has this transfers work? No? So we also explore other determinants that have contributed to the recent expansion of these welfare institutions. Because we take a look at the global perspective, we couldn't do what normally other colleagues have done in the past, which, for example, there are very interesting qualitative studies, you know, doing a deep and very careful analysis of specific cases. There are also previous econometric studies which have some restrictions and limitations, in part because of data. The data is very complicated, I will tell you now a bit of the story. But also in the past, econometric methodologies were probably not developed to the extent to deal with some kind of problems that we face when we are trying to unpack these kind of causal relationships. And there's been a lot of focus on multilaterals and bilaterals in particular. So we take a much more generic approach, and we explore the channels that the literature highlights to see the extent to which they respond to the findings that we get in this study. So part of the literature highlights different actors that together with foreign aid have facilitated that interactions. So what we did with another of my colleagues, we tried to identify other key determinants. We conducted a systematic scoping review, so very methodologically rigorous to identify what the evidence says so far. No? So, and it was quite a monumental work, but in the end, it was very, the returns were good because we could identify, first of all, different theories that try to explain these relationships, and also factors that under these theories connect with the expansion of social protection. So in this case, the blue arrows show significant and positive relationships that ultimately impact social protection expansion. The red arrows show a negative effect and significant. And the yellow one show insignificant effect. So either because the data is not strong enough to show some statistical evidence, or simply because there is nothing in there. No? So because of data, sometimes we cannot say that. So we focus in this little block. No? But as you can see, foreign aid has a direct and indirect relationship with multiple factors. And of course, different theories try to explain those mechanisms, but they overlap very often. No? You think about institutional theories and agency theories very often use and rely on assumptions that are similar or they borrow from each other. And also, many people in institutions, for example, rely on norms because norms are very important to shape institutions. No? And also, for example, agency theories also rely very much on things like elites and political institutions to develop certain hypotheses about this relationship. So we are focusing on here, but nevertheless, we look at different determinants or factors in the empirical strategy that we have adopted. So the next step is how to measure foreign aid sector. Because we take a global approach, what we have done is to look at the OECD DAC CRS data, which is problematic for many reasons. And if you want, we can discuss this. But so far is the best we have to look at transfers overseas foreign aid in this case. And there, for example, these activities are clustered in this code that reflect activities that are related to social protection. So there are several activities that cluster in one particular code, and this code is allocated, financial resources from different donors. So we take two definitions of social protection aid. One is a narrow definition that has a much more narrow definition in terms of the type of policies that contain those flows. And then we take a broader definition that also includes broader definitions of social protection that include labor market policies. For example, active labor market policies, also interventions to mitigate the effect of HIV, AIDS, especially in Southern Africa, where they are combined with cash transfers and complementary interventions, labor rights, and social dialogue. So these are all related to the support of welfare institutions. So we work with data that reflect two definitions of social protection aid. If you have questions, please stop me anytime. So well, once we plot a summary of the data, you can see here, this is total developmental aid by different age brackets. And we can see here the share of social protection aid to total development aid. No? So in the 5-year interval, in the last round of data that we have, about $2.1 billion at constant prices were allocated to social protection, taking the broad definition. No? And you can see who were the main contributors to these flows in relative terms. No? So one of the things that, first of all, we see is that if we take the narrow definition, which primarily focuses on social protection, so social assistance and social insurance, without labor market policies, we can see a significant decline in the allocation to those institutions. Yes?
Sorry for the interruption.
No.
Is this country year data? And if you could expand on what you mean by social protection here, like which areas broadly included?
Yes. So these are allocations going to countries, recipient countries. So imagine multilaterals, the World Bank, Inter-American Development Bank, Asian Development Bank, bilaterals, ACDO, SIDA, the NIDA, et cetera, et cetera. So these are the years over which we have data. And the categories for social protection aid the broad and the narrow are these. So activities that have received aid for those activities. Yes.
Thank you. I think also a clarifying question, because when you showed us this table that was like traffic lights, I noticed in North America that was 100% for mothers and newborns, and being European, I'm quite skeptical in terms of what the quality and extent and coverage of that aid actually is. And I'm wondering also with that respect, when you say best doing in advice, for example, is it whether the policy exists at some level, government, local level? Is it how many people it actually reaches? Also, if you cover maternity leave, is it 2 weeks, is it 2 years? Because qualitatively it's quite different. So how exactly, when you're showing us that, like what exactly is behind the data when you talk about, we give that many billions, but then is it a policy? Is it how many people benefited? Is it a share of the population? Is it how long? So
Yeah. So this, yeah. This is the first outlook. This is total aid without being normalized, I would say, by population, no, or by different population subgroups. This flows, all of these are clustered into this code. So one of the things we wanted to do, obviously, was to look at different components of aid and then link those allocations to specific policies. But the way so far the OECD DAC CRR's data, the data is not possible to do that. No? Of course, that would be the best way of doing it. At the moment, the way the accounting approach that the OECD takes, you cannot disaggregate this, unfortunately. No? Of course, we suspect that even within this particular definition, there are multiple programs, cash transfers, unemployment schemes, etc., etc. So, and then here also there may be different populations. So, and then within each country, we don't know exactly which region receives aid. That's another major problem. No? So, Ethiopia is one of the largest recipients of foreign aid in Africa, but we don't know exactly where this aid is going. And very often we don't have the data because the data has to be provided by the government, and the government doesn't provide. So there are a number of factors. Yeah, you're totally right. So that would be the best possible scenario. Yeah. Probably this can be done when you do a case study. No? You focus on one country and you can go into the micro aspects of that. And this is what colleagues have done. Okay.
So I always bang on to my students about the fact that quite often when we say aid, it's not necessarily going and being channeled through government budget. So is this data available as well? Is it going through implementing partners such as the UN? Is it going through, what percentage is going through national budgets?
Yeah, I can show you some slides which in a way try to capture this. You know? So here is global aid to social protection. You can see here the flows by bilaterals and multilaterals, which is very distinct by what you observe in the overall developmental aid. In social protection, multilaterals are playing a much more greater role in the expansion and support of institutions, contrary to what we find in education, health, nutrition, sanitation, no? Where bilaterals are the primary funders and drivers of those interventions. No? So this is first interesting observation, just from purely a statistical point of view. But something else that is interesting is when you look at the type of instruments that are used to allocate resources. So you have grants, which are essentially allocated without any commitment. And you have debt instruments that can be soft loans or different types of mezzanine financial instruments that require a commitment by the government and the treasury to pay back at least a share of the funds. You see that debt instruments have, by large, dominated the transfers to social protection in the global south, contrary to what you find in terms of bilaterals. No? Bilaterals, because of their incapacity, technical incapacity, or problems in their financial instruments that they can allocate. Many, for example, FCDO doesn't have the financial rights to implement, for example, bonds. So it has to go through the treasury. No? So there is a multiple technical aspects that limit the ability for multilaterals to use debt instruments. And this, in part, this explains this distribution. But one of the interesting things when you look at the recipients of the last decades in terms of global aid to social protection, we see something very interesting. Well, if you look at the multilateral flows, which is I think the most interesting aspect, you see that first of all, Latin America was and has been one of the main recipients of financial support to the sector. But other important thing, of course, you see after 2010, which coincides with several agreements in the sub-Saharan region, and also a more active role of, for example, the World Bank in particular, but also DFID at that time, XDO more recently, but XDO hasn't done much. But UNICEF and a few other organizations, you see sub-Saharan Africa becoming a much more important recipient of foreign aid. But another factor that is very important to highlight here is that these peaks that you find here reflect shocks. So social protection is not only an instrument for redistribution, but it's also an instrument for countercyclical policy. So in terms of crisis, here these spikes, many of the Latin American countries that went through terrible stories. You find also here the financial crisis of 2008 and 9. So you can see this massive increase in allocations that also reflect the increased demand for support, but it's also located to economic business cycles. No? So social protection institutions are a very important instrument to mitigate the effect of global shocks. And this is one important aspect that even the data shows without going into the more formal econometric analysis. No? So this is a boring part. So I will not spend so much time on this. I just want to give you a quick overview of what we do, but you don't have to. In the paper, there is a more sufficient discussion, but essentially what I want to say is that because we have a panel of many countries over 3 decades, and you observe this, sensor distribution. At the beginning, you remember around 2000, there were just a very few countries, and then you saw this expansion. This is not a normal distribution, no? It's a sensor. So in econometry, we pay attention to these small things. So we have to implement certain methods that accommodate these violations that normally we have to pay attention when we do regression analysis. No? So we implement certain models in which C is coverage, the number of individuals covered by social protection, and then we introduce a set of controls, the controls that refer to the theories that I discussed before. So elements that capture, political elites or governance or democracy. So in this vector, there are certain elements that try to capture the noise that may explain this relationship. This is aid. Obviously, all of them are normalized, and then this is fixed effects. And so we use instrumental variables, which is obviously not desirable. It's not perfect, but life is not perfect. So, and one of the things, as you were saying, that sometimes you have to normalize by population. So the TOVID model that I presented doesn't address your question, that you can allocate $10,000 here, and then if we normalize by all of you, the share is very different. So we have to normalize by population. So we adopt another method that captures this and mitigates this particular problem, which takes this approach and essentially is represented by this equation, which is a fractional response model, again, using instrumental variables. So we used two instruments. So we tested the instruments and we did a number of tests, and all the tests are in the paper. So I don't want to waste your time. But the two sets of instruments are a combination of actual instruments. The first one is inflation in donor country, weighted by the trade intensity between donors and recipient countries, and the share of women in parliaments of donor countries, weighted by the rainfall shocks in recipient countries. And I will give you the rationale of how this works. The second combination uses, again, inflation in donor countries, again, weighted by the trade intensity between donors and recipient countries. But then here we combine the share of left-wing government parties in the overall parliament. And also, we look at, obviously, this is weighted by rainfall shocks. No? So here is the, the rationale. So first of all, the idea is that when you have countries in good times, there's inflationary pressures, no? Because consumption increases demand, so inflation goes up. So very often in those situations, foreign aid is a good mechanism to reduce inflationary trends. So there is an incentive to allocate more resources. And then this relationship will be stronger when we have historical linkages. So we know FCDO has a very active role in former colonies, whereas France also is more active in West Africa, for example, in the MENA region. You know, there are historical reasons why these links appear. So we exploit these relationships in our identification. The second rationale is that women in parliament, as well as left-wing parties, are, on average, not always, more likely to allocate more aid than men and conservative parties. So, and the reason why we instrument these indicators and we weight this by rainfall shocks is to proxy an income shock. No? So when there's droughts, we know that there is an increased demand for resources, and there is a systematic evidence. At the same time, when there is, you know, for example, climate events, no? So destroy the, for example, what happened last year in Pakistan, no? This terrible floodings. So we saw immediately an increase in foreign aid to support Pakistan. No? So this is the data that we use, and we conducted, as I said, many studies to test the validity of the instruments, and in the paper we show the results, and all the instruments passed the test. Of course, instrumental variables, sometimes it's a matter of whether you believe in the instrument or not. So I will not try to convince you here. But what I want to say is that at least on the theory and on the statistical aspects, they pass the test. But you may not believe me. That's fine. So this, instead of presenting the tables, maybe it's nicer to present these rope ladder plots, essentially that show the markets for point estimates, and the spikes reflect the confidence interval. So here we conducted several models. If I remember correctly, there are 8 models that capture different theories, and the determinants that you remember, this spider net that show different determinants and different theories. We try to capture those dimensions in different models. So there are different models. I present model 1 and 2, and here are the effect of different type of aid based on the broad and the narrow definition, no? And based on this evidence, you see that all the results from the global perspective show a significant effect. The confidence intervals are very small, so you can believe me or not, but you can trust the results. And the effect are different than 0, which means that obviously the effect is significant and statistically speaking. No? So the story is that aid is contributing, but the effect is very small. No? So it's not just aid. There are many other factors that explain the evolution, as I was mentioned about before. Is the politics, is in part financial crisis. There are many other factors, but one of the elements among all these cocktail of factors is foreign aid, or appears to be a strong determinant. We find a significant variation by regions. So in Latin America and the Asia Pacific region, we find significant effects for most of the donors. But here, what is driving the effect are essentially multilateral, which is consistent to what I show you. So multilaterals, and when I say multilaterals, in practice is the World Bank. So don't think that it's the African Development Bank or DFID or any other multilateral. So it's essentially the World Bank. So just to give you an interpretation or economic interpretation of the findings, which is easier because if I give you a point estimate, doesn't matter. So it's better to maybe take the top 5 recipient countries of social protection aid between 2015 and 19, which is the last data that we had at the time, and then the effect of 1% increase in aid to social protection will move coverage from this baseline to that baseline without normalizing. No, this is absolute values. And so you can compare also what is the contribution of grants to total aid and also the contribution of aid to social protection as expenditure. So you can see in the case of Ethiopia, without donors, it would be very difficult to sustain most of the programs at the moment. So Ethiopia currently is unlikely to sustain the scale of programs that they have without the intervention of donors, which is very problematic. So it's not just about whether the effect is there, but also the counterfactual is, well, if donors decide to stop, what is going to happen to many of these countries? So, and this is very problematic for many countries, even large countries in the region. So how much do I have?
We have about 15 minutes.
Okay,
20 minutes.
Okay, so maybe what I can do is just quickly take you through other things or other questions that we try to answer. So what are the effects of other factors that together with aid are influencing the evolution of social protection systems in the global south? So, well, first of all, we find that in sub-Saharan Africa, there is, for example, limited influence of, for example, the ILO or the role of, for example, the ILO conventions. These are parameters that signal the government's commitment to, for example, allocate resources to social insurance, social assistance, labor market policies. So there is not been, or the signature of this kind of conventions, the ILO is one example, also signal how the politics play in this kind of context. Also, international organizations here, or the evidence suggests that have been really unable to persuade and negotiate the expansion, in part for many other reasons. So I think there is limited leverage to expand these institutions and also reflect political priority. What we observe in sub-Saharan Africa, but also in Latin America and in Asia, is there is a strong incentive to use clientelism because it has very high returns. The electoral return is very high. So for example, rather than to implement a programmatic policy, it's more lucrative in political terms to implement certain policies that give the incumbent an incumbency advantage. So policy diffusion is another aspect that has been important in some regions. In Latin America, for example, the example of the the success of Progresa in the late 1990s and early 2000s, and then Oportunidades was a case that helped the expansion of cash transfers in Latin America. So it's a very good example of policy diffusion, the role of the Inter-American Development Bank and the World Bank in saying, look, this is working, it works like this, so why you don't do it? And we give you a credit to do it. So this kind of strategies have been important in certain regions, but not in others. And this is coming from the econometric analysis. So there are factors, economic drivers. Obviously, economic growth is a key determinant. Without growth, it's very unlikely that you will expand the fiscal space to finance welfare institutions. But also there are things about resource-rich countries, which is the case of many African and Latin American countries, that there is also a rent-sinking problem there. So when you have natural resources and you have tax resources, the incentives by incumbents to mobilize taxes or mobilize resources via taxation is much more lower than if you use natural resources, because there is no political cost. So you just use natural resource rents rather to tax the rich or the middle class. So, and therefore, these resources very often are not used optimally in many cases. So we find a negative relationship actually when you have a rich resource country and you have weak institutions, you have low state capacity, So we explore demographic aspects, and obviously HIV has been a key factor in the expansion of, for example, the old age pension in South Africa. The crisis of orphans in the 1990s pushed the government to expand pensions because pensions became carers. So that was the first step, but then the child support grant was the next step when they realized that the pensions were insufficient to address the magnitude of the impact of HIV in the southern region. So HIV prevalence also was a very important trigger in expanding institutions in the southern part, knowing the rest. And there are other things that also have very negative effects in the ability of countries to implement welfare institutions, which is obviously the structure of the economy, the informalities, is also something that reduces the ability to mobilize resources and also creates all sorts of incentives that limit broader redistribution efforts. Colonial history, well, we find interesting things. So French colonies tend to have more centralized welfare systems, whereas British colonies show more fragmented structures, which is interesting. Obviously, the varied impacts of colonial legacies are very different. Some countries have reformed their constitutions to move on from systems that reproduce inequalities, but in the majority of the countries, we perceive and exist still, the effects of the colonial heritage is still there in the institutional framework and in the legal framework. So when you have the elites controlling resources, that is the result of long relationship with colonial powers back in the case of Africa in the 50s and 40s and before. It's very difficult to break this kind of institutional, legacies. And also, obviously, there is a path dependency, which we find that also countries in Latin America that were independent 200 years ago, they have been able to move a little bit more in the institutional building, but it takes a lot of time. So 200 years and still you find a lot of legacies from this Spanish legal tradition. So, and these are very difficult things to break. And just quickly, the institutional factors, issues of governance and political settlements are also important. So strong institutions, legal frameworks that support transparency seems to be strongly correlated with, finance to these institutions. in part because you start to see a transition from more clientelistic to more programmatic politics. When you see an excessive prevalence of autocracies, it's very difficult to break down this. No? So there are all sorts of incentives to keep the clientelistic exchange, whether you are in power or you are in opposition. We find that governments or parties in opposition, when they become elected, they simply reproduce the same pattern. And well, this is related to my previous point that this party institutionalization in certain regions in Latin America, this relationship with parties have, and the relationship between parties and, for example, trade unions, is very important in Argentina, Mexico, Chile, etc. So they have led to policy continuity in this kind of imperfect system in which you have parallel systems, social insurance covering informal workers, social insurance, social assistance covering informal workers, no? And you get a suboptimal equilibrium here, no? But then this party institutionalization creates this political settlement, no? That remain there. And then, well, we explore and investigated the role of ideologies, and we didn't find really whether a left wing or right wing government in many developing countries have different policies. In fact, surprisingly, sometimes the right-wing governments were the ones who implemented more progressive policies, and then the left wing, in between brackets, so they were the more clientelistic. No? Very sad, at least for me. And then finally, external shocks. No? Clearly, financial crises were very important triggers for the expansion of welfare institutions in Latin America. There's no question about it. No, I can tell you many stories for different cases, but we don't see the same in other regions. No, in sub-Saharan Africa, the financial crisis have actually reduced even more the fiscal space, and then also the subsequent reliance on commodity exports, and this is also creating all sorts of red-thinking behavior, as I was discussing before. And weather shocks, well, weather shocks, there are cases that weather shocks play a very important role, like in the case of Ethiopia, you know, in the 1990s, where first the droughts in the 1980s, then subsequent efforts to stabilize the country. And for example, all the efforts with the PSNP clearly is related to weather shock. No? Is a safety net for countries which exhibit very high likelihoods of droughts. But we don't find in fact, we find a negative effect on weather shocks on the expansion of social protection across the board, with a few exceptions, as I said, which is Ethiopia. But weather shocks are bad news. So, and this leads to the argument of climate change. So we don't have a tremendous effect on the ability of societies to respond to shocks. Well, I just want to conclude. Yeah, well, essentially, so we find a positive but very small effect of aid in the adoption and expansion of welfare institutions. But in fact, or the fact that these channels have been observed via debt instruments, especially in sub-Saharan Africa, at least signal a kind of perhaps short-term, medium-term commitment by governments to support these reforms. Whether countries will be able to then fulfill their commitments is a different story. Ghana, for example, 10 years ago, committed to expand cash transfers, and now Ghana is going through a very difficult time because of the debt crisis. No? So these are elements that play a role here. But obviously, as you saw, there are multiple factors that they are connected, all of them. They're very complex relationships, but also this makes this a very interesting topic if you want to explore this in more detail. So, but that's it. So I'm happy to take questions.
Thank you.